Welcome to part 2 of our Neurology Nutrition Masters course. And our objective in this part is really to just, much more briefly than in the previous one, look at examples of products that are available that can actually address these conditions that we've been talking about. So we're going to start with neuroprotection. That's where we started with the NMC in the first place. And the primary products that we have in this space is it's called Cerulin Fort. So we're going to just have a look at the ingredient profile. So when we spoke about preserving the integrity of the central nervous system, we spoke about particular ingredients that really allow the body to do that very well. Those included acetyl L-carnitine, N-acetylcysteine, grapeseed extract with the proanthocyanidins, folate, especially activated folate in B12, ideally as methylcobalamin, riboflavin, niacin, vitamin B1 and vitamin B6. And this actually is the formula of Cerulin Fort that contains all of these in researched amounts to support these actions within the central nervous system and help to promote neuroprotection. These nutrients really can help to support the modifiable pathways associated with healthy brain aging, including oxidative homeostasis by serving as precursors for the most important antioxidants in the brain, and also providing antioxidants that can cross the blood-brain barrier, such as the grapeseed extract, lifestyle factors, neurogenesis, methylation with the 5-methyl tetrahydrofolate and methyl B12, circulation, once again the grapeseed extract, important for blood vessel integrity, and mitochondrial efficiency, the acetyl L-carnitine especially active in that space. Here we see the formula for Cerulin Fort in terms of the dosage per capsule. Notice the good high dosing on the N-acetylcysteine, the acetyl L-carnitine, and also the grapeseed extract. In summary, with regard to Cerulin Fort, we see that it provides a multi-mechanistic neuroprotective formula. The bottle has 90 capsules. The dosing is 3 capsules per day, so it's a month's supply. We see these significant levels of grapeseed extract, good high doses of 5-methyl tetrahydrofolate and methyl B12, N-acetylcysteine, acetyl L-carnitine. So by multiple mechanisms works to protect the neurological system. And we also see support for the cerebrovascular system, that the perfusion of blood through the neurological tissues is supported, and also oxidative stress defense, as in antioxidants that are capable of crossing the blood-brain barrier and stabilizing the neurochemistry and the biochemistry within the brain. Apart from general neuroprotection strategies, as used in the Cerulin Fort, we also spoke about strategies specifically looking at cognitive decline and helping to prevent the progression of cognitive decline. We spoke about using nutraceuticals to address the key mediators of changes in memory and thinking skills. So we spoke about addressing the excess production of amyloid beta and tau protein, supporting mitochondrial maintenance and normal function by preventing excessive oxidative stress and also enhancing ATP production. We looked at microglial activation, so that's the immune system within the brain, and also the influence of insulin and how high insulin, which is translated into low sugar, reaching into the cells in the brain, could translate into increased inflammation and degeneration in the brain. And then also looked at aging and gene expression. So we know that particular genes do predispose people to the development of Alzheimer's disease, and we would want to put in place mechanisms to minimize the risk to people that suffer with those genetic alterations. In our review, we highlighted 2 main ingredients that have great potential for action in preventing cognitive decline. And the first was huperzine A. It was that purified alkaloid from Chinese club moss, which showed to be able to preserve acetylcholine production and increase the inhibition of acetylcholine esterase. So acetylcholine was present in the synaptic space for longer. It provided neuroprotection by inhibiting glutamate toxicity. It provided mitochondrial and also antioxidant support, and provided protection against amyloid beta toxicity and production. The other ingredient that was highlighted was colostrin, or proline-rich polypeptide complex, and it was aiming primarily at influencing inflammatory cytokines. It has antioxidant effects within the brain. This was one of its mechanisms of neuroprotection, but also it was able to interfere with the NMC receptor that would normally induce calcium mobilization and often catastrophic cell death. So that's our glutamate receptor. It helps to reduce the activity in the glutamate receptors. So these two ingredients are combined in a single product from Metagenics called Ceriva, and it's really an important product to consider in patients with early cognitive decline or risk factors for cognitive decline. The Ceriva product has blister packs with 30 tablets. Each tablet contains huperzine A and the proline-rich polypeptide complex in the amounts that were actually used in the studies, confirming efficacy in these conditions. The dosing we need to just look at, it's 1 tablet per day. Definitely people should never exceed 2 per day. And then, because we are using natural substances that have strong effects, there's the possibility of some side effects, and especially also interaction with other drugs that act on the same pathways. So people that are taking acetylcholine esterase inhibitor drugs or cholinergic medication, there's definite interaction potential, and they should not use these medications at the same time. Also, patients that suffer with seizure disorders, that have got cardiac arrhythmias, patients with benign prostatic hypertrophy, with asthma, with chronic respiratory conditions, with peptic ulcers, inflammatory bowel disease or malabsorption syndromes, all of these, acetylcholine is active in modulating these conditions, and it could be part of what's going wrong. So we wouldn't want to disturb the body's balance by modulating acetylcholine in that therapeutic space. So don't use this product in patients that have these conditions. And then some people are uniquely sensitive to these ingredients, and in those cases it might cause a mild but temporary anxiety or mood change or sleep disturbance, dizziness, fatigue. If side effects like this develop, we should just really use it as an indication that this product is not suitable for those patients. Our next discussion centered around improving our patients' ability to seek focus and improve their attention and concentration. Metagenics has formulated a product called Atensia that follows the path laid out by conventional medication, who's essentially had a focus on stimulant use. But apart from the stimulant aspect, the formula also looks to provide neuroprotection, healthy brain aging, and also look at some of the underlying causes of inattention or difficulty concentrating and actually addressing those as well. Atensia has been formulated with 6 primary ingredients known to enhance focus and support healthy cognition. These include caffeine, theanine, guarana seed, essential fatty acids of omega-3 and 6, and also zinc. Working together, these ingredients balance the stimulating action of caffeine with compounds that will actually prevent damage to the nervous system and the long-term risks that stimulants might entail. We see the formula for Atensia. The highlights are the EPA and DHA and GLA. We can see quite a lot more DHA than the EPA, and a good high dose of the omega-6 oil, the GLA. And then we see our proprietary blend of caffeine from green coffee bean, green coffee extract, and then the guarana, all of which are sources of caffeine, but also polyphenols and chlorogenic acid. And then of course the theanine, which should be working to help settle the nervous system down. So in total, it would actually give it a yield of caffeine of around 100 milligrams, which is comparable to pretty much a cup of coffee. People that are sensitive to caffeine should, of course, not use this product. People that are under 18 years of age, the safety of caffeine at these levels, has not been established, so either with caution or not at all. And then caffeine being a stimulant in people who already sometimes are overstimulated can actually be a problem for them. And the way that we'd see it would be nervousness, sleeplessness, rapid heartbeat. And if we're seeing symptoms like that, those would be reasons to rather not use this product for those patients. Our next topic that we discussed was how to influence with nutritional strategy low mood, and also understand that treating the brain in isolation is a mistake. There are drivers within the body that could be contributing to the state of the brain, and there are drivers within the brain that could be contributing to the state of the body, and we need a more holistic view to actually have a proper treatment that is going to work and going to last. Our next topic for discussion was low mood, and we spent some time looking at the links between depression and inflammation, and understanding that inflammation in the central nervous system can be a perpetuator and driver of depression. And so treatments that are developed that don't take brain inflammation into account, we could conceive that they could be not all that successful in the long term, because they're not really addressing the drivers of the condition. When we're looking to address low mood, it's important to not only focus on neurotransmitters in terms of modulating the production and also how long the neurotransmitter stays in the synaptic space, but also to look at the health of the neurological tissue itself, especially with regard to neuroplasticity, the potential of the nervous tissue and the nervous cells to form new connections and also to form new cells. So the activity in the system is controlled by inflammatory cytokines to a large extent, and it's especially tumor necrosis factor alpha and interleukin 6 that modulate these pathways. So if we have increased inflammatory signaling within the CNS, it can lead to decreased neuronal plasticity and decreased levels of secretion of brain-derived neurotrophic factor, leading to reduced neurogenesis and impaired ability to cope with the stresses, and also having effects on our ability to think new thoughts and develop new behaviors. With all of these factors in mind, Metagenics staff has formulated a product called Serosin that actually contains nutrients that work to address all of these factors that can be at play in problems with low mood. Here we see the formula for Serosin. Please notice there's a mistake on the slide in that the quantities are actually one line up from the individual ingredients. So for instance, if we look at vitamin B12, there's definitely not 200 milligrams of vitamin B12 in the formula. It's the 200 milligrams of the Chinese skullcap, 100 milligrams of 5-HTP, 100 milligrams Asian ginseng, and 80 milligrams L-theanine. So in terms of how to take them, it's one capsule 3 times a day is the normal direction. You'll notice it's available in 30s and 90s. Then warnings, we should not use in our patients that are pregnant. And there's also caution. Safety of this product has not been tested in minors, so people under 18 years of age, we preferably should not use them. Patients that are taking antidepressants, especially monoamine oxidase inhibitors or selective serotonin reuptake inhibitors, there's definitely a potential for interaction with those products, and we should not use them at the same time. People that have problems with gastric permeability, there could also be an issue. Some people may also experience some drowsiness using the formula. So our recommendation is that people that are taking it should avoid driving or operating machinery that could place themselves or others in danger. So these are just cautions. They would apply equally to drug treatments, and typically they would just be at the initiation of the treatment. It's not that everybody that uses the product would develop potential troubles like these, but in the beginning, for the sake of safety, it's best to err on the side of caution. Because of the concerns with interaction between sericin and antidepressant medicines, Metagenics has also formulated Blisfora, which has a much lesser potential for interaction. If we look at the formula, we'll see that it's essentially a methylation support formula. We see quadrifolic, which is a special form of activated folate. We see methylcobalamin and also SAMe, or S-adenosylmethionine. And these are really all components of the methylation cycle and work to potentiate healthy methylation. Now, healthy methylation is necessary for normal production and synthesis of neurotransmitters, especially dopamine and also serotonin, which is involved in mood. So it's quite possible that in many cases poor methylation is one of the mechanisms that's maybe contributing towards low mood, and so supporting healthy methylation can support neurotransmitter production and possibly elevate mood. And there have been several studies looking at this, both with injected forms and also oral dosing of SAMe, and they found them to be comparable in some studies to using conventional antidepressants. So there are various methods, mechanisms of action at play with SAMe in mood. Primarily it's to do with the methylation, but also SAMe is involved in transsulfuration, which is part of the synthesis pathway for antioxidants that are able to cross the blood-brain barrier and be present in the brain and be neuroprotective as well. So it's a safer formula if a person has concerns about the potential side effect profile of the sericin. The side effect profile potentially of the Blisfora is much lower, and also the scope for interactions with drugs is much lower. It's not non-existent, but whereas with the sericin it would be essentially contraindicated, with Blisfora it's more of a caution that we should start with low dosing, monitor, and we should expect less interaction using this formula. So that's Blisfora, and another great addition to the lineup. Our final topic for discussion was considering taming tension and looking at promoting the balance between GABA and glutamate. And in this space, Metagenics has formulated the product Trencor. Trencor is the combination of N-acetylcysteine, taurine, magnesium, green tea catechins, and vitamin B6. And the purpose of its formulation is to assist in balancing GABA and glutamate by enhancing the GABAergic pathways and improving the removal of glutamate from the system, and also protecting the physiology from the excitotoxic effects of glutamate. Here we see the quantities of the ingredients in Trencor, and you can see the considerable amounts of taurine and N-acetylcysteine. And please take note of the dose. 2 capsules twice daily is the standard dose, although if used in conjunction with one of the nervous system, one of the stress products, you could consider using half of that dose, or starting with a full dose and coming down to half that dose. That concludes our review of the Neuro range of products from Metagenics. I hope it's useful to you. It's a powerful ally in supporting nervous system health and helping to prevent both functional and degenerative neurological disease. All the best.